Assalamualaikum. Today we'll be discussing about the anterior abdominal wall. In this part we will be discussing about the skin and the fascia, the superficial fascia and also the deep fascia. As we know, in the anterior abdominal wall, the skin is loosely attached to the underlying structures, and it is also flexible. It is also flexible, except at the umbilicus. What is umbilicus? Umbilicus is a scar. Representing the area where the umbilical cord has been attached in the fetal life. And umbilicus, where it is situated? It is situated in the linea alba, the midline in the linea alba, the midline in the abdominal wall, and the then we'll discuss about the carpet medusae. Actually, this is a Greek word, and it is medusae means goddess with numerous heads. So umbilicus also shows the area of porto. Cable, anastomosis. Umbilicus also shows the area of porto, cable, and anastomosis. Porto means portal, and cable is the systemic veins, and where the portal vein and the systemic veins anastomose. Okay. So if there is portal hypertension, what does that mean? That there is some obstruction in the portal pathway, so all the blood will be coming back towards the umbilicus, and over here the veins will be dilated, and it will be similar to the carpet medusae, like it has numerous heads. So veins in that region will be dilated, and this condition is known as carpet medusae. So next term we will learn about this linea albicans. As we know, the skin in the anterior abdominal wall is very loose, and it is also flexible. So in the pregnancy, or it is stretched, or there is some intra-abdominal tumor, it is stretched. So this when it is stretched, it results into white lines. The skin of the anterior abdominal wall is stretched and forms the white lines. Okay, so these white lines are actually known as linea albicans. Okay, so next we will be discussing about the fascia, superficial fascia and deep fascia. There are two types of fascia, superficial fascia and deep fascia. But the superficial fascia is then divided into the superficial fatty layer and the deep membranous layer. Superficial fatty layer is the normal fascia which lines the organs and everything, all the structures of the body, but it is not present in only two regions. It is not present only in two regions, and those are venous and scrotum. And I will demonstrate it by a diagram. How it is not present over there? That this is a diagram. Okay, in this diagram, if we see that this is a superficial fascia, and this downward it moves in, it is divided into the fatty layer, which is also known as the Camper's fascia, and the membranous layer, which is known as Scarpa's fascia. If you can see, this is the purple lining, and this is the fatty layer. Okay, so this is the superficial fascia. Both are these subdivisions of the superficial fascia. So as soon as it enters into the venous, the superficial fascia loses its fatty layer and fats, and it fuses with the deep membranous fascia. It fuses with the deep membranous fascia and forms the Darto's fascia. Like this is the Darto's fascia. So in the venous and in the scrotum, it is not present, and except over there is the Darto's fascia. Darto's fascia is the Okay, so and as soon as the superficial fatty layer enters the scrotum, it is replaced by a muscle which is known as dartos muscle, and this forms the dartos fascia. Next, the subdivision of the superficial fascia, we have the deep membranous layer. Deep membranous layer is formed by deep membranous layer is fuses with the deep membranous layer fuses with the fascia of thigh and forms the fascia iliaca. Fascia iliaca below the inguinal ligament. Below inguinal ligament. So, and then also the deep fascia, deep membranous layer. We're talking about this deep membranous layer. Deep membranous layer then also forms the Colles fascia. It is very important. It is also very important, and it is also asked in Viva questions that Colles fascia. Colles fascia. What is Colles fascia? Colles fascia is the fascia which is lining the perineum. And where is perineum? Perineum is the location between the two pelvic bones. So the area between the two pelvic bones is known as the perineum, and the fascia which is lining the perineum is called the Colles fascia. So its importance. Its importance I'll discuss over here. Okay, over here we have Colles fascia and its importance. Colles fascia. Now we'll discuss about its importance. Actually, in the conditions when the urethra ruptures, the urine leaks down, and nature has provided a barrier. So if the urethra ruptures, urine does not leaks into the thigh. So this is provided by the two structures to which the Colles fascia is strongly adherent. These two structures are the Haldane's line and other the Adductor Longus and gracilis, which forms the medial side of the thigh, gracilis. So I'll explain the Haldane's line. Haldane's line. Haldane's line is actually, over here we have pubic crest and pubic tubercle. So Haldane's line is the line which extends from the pubic tubercle and laterally 8 cm laterally, and over here we draw a Haldane's line. Next is the Adductor Longus and gracilis, which forms the medial side of the thigh, and Colles fascia is strongly adherent to these two structures, Haldane's line and Adductor Longus and gracilis, and it prevents the leaking of urine into the thigh. Then we'll talk about the deep fascia of the anterior abdominal wall. Deep fascia. Deep fascia is deep to the superficial fascia, and there's nothing much more description about it except that it is deep, and that's all. Thank you for watching.